Hello, everyone, and happy Friday. My name is Jeffrey, the Global Consortium Manager for iCCaRE, and welcome to our August 2026 educational webinar. Today's webinar will feature one of our Planning and Evaluation Core leads, Dr. Damian Francis. Dr. Francis is an epidemiologist and public health evaluation scientist, serving as Associate Professor of Public Health and Director of the Center for Health and Social Issues at Georgia College and State University. His work focuses on program evaluation, implementation science, health equity, and chronic disease prevention. Dr. Francis leads multiple state and federally funded evaluation initiatives in partnership with the Georgia Department of Public Health, including development of monitoring and evaluation frameworks for chronic disease programs, evaluation of asthma control and SNAP ED nutrition interventions, and technical assistance to public health districts to strengthen data systems, performance measurement, and reporting capacity. He also directs evaluation of CDC REACH funded nutrition and food environment initiatives and has conducted community health needs assessments addressing tobacco use disparities. Dr. Francis has authored more than 100 peer reviewed publications and brings extensive experience translating evaluation findings into actionable public health policy and practice. With that, I want to introduce Dr. Damian Francis.
Hi, good afternoon.
Hello, Dr. Francis. For joining us. All right, thank you for joining us. Let's go ahead and get right into your presentation. We are glad to have you this Friday.
All right, wonderful. Thank you so much for having me. Today, we have the opportunity to talk about some of the amazing work that is going on in iCCaRE. And we're going to specifically focus this afternoon in looking on evaluating the extent of collaboration and quality of communication within the iCCaRE consortium. I want to take this opportunity to first acknowledge the amazing team that lend their voices and talent to the work that we do in the evaluation core. So I want to recognize our team members here on the screen. Ivy Breland, our research fellow here at Georgia College and State University, Dr. Bonner, Dr. Keninjin, Dr. Bassi, Dr. Okoy, and of course, Jeffrey Gaynor and Jada Melton, who are with the management section of iCCaRE. So we want to recognize them for their tremendous contribution that they have made to the evaluation core team. You know, when we think about science, undoubtedly, we have made significant progress rather, over the last couple of centuries. Moving from someone like Edward Jenner working on the smallpox vaccine in 1796, working alone, in his kind of physician setting, to moving to the 1990s, where we see the Human Genome Mapping Project, where over 3,000 scientists globally working together rather than in a single room working by themselves. And so we see the value here of working together. And this is what iCCaRE brings to the prostate cancer research arena, in that this international consortium works primarily to bring together experts from around the world to look on how we can advance the science around prostate cancer prevention, prostate cancer management, and just narrowing the disparities, if not eliminating them altogether, that we see with prostate cancer morbidity and prostate cancer mortality. The international community has well recognized that there is a need for bringing together experts with diverse disciplinary expertise and complementary skill sets, mainly because this is what is needed if we're going to solve a global problem. And these advances in technology really enable real-time communication and information sharing, reducing many of the traditional barriers to international collaboration. So with the onset of technology in terms of communication and collaboration, we have seen a flurry of consortia all around the world tackling issues from prostate cancer to breast cancer to other chronic non-communicable diseases. And they have really been making a tremendous impact on the science as we know it. So the growth of any multi-center cancer research consortia increases the need for systematic evaluation. And I like to say that evaluation is only as good as if it is used by those who employ the evaluation of a project or evaluation of outcomes or processes. In particular, we find that process evaluation provides the formative insights into how the collaboration function, and therefore it supports the ongoing learning and quality improvement that is needed when you're operating a global machinery to advance science. To this end, iCCaRE has within its core and services an evaluation core that aims to evaluate and improve the performance of the Inclusive Cancer Care Research Equity Consortium. We do this primarily through an evaluation framework. And as you can see on your screen, our evaluation framework brings together projects, pilots, core services, collaborators, partners, and the public. And all of that feeds into our mechanism of how we collect data. And we move from quarterly report audits to a general evaluation survey. We have specialized survey targeting our early career investigators. And then we look at how we are interfacing through our media survey as well as event surveys for one-off events that are done for education or capacity building with the community. All of that is underpinned by 5 evaluation areas. These areas are taken from the HMO Cancer Research Network that was adopted, and this work was done back in 2005 by Green and colleagues, and they pretty much provided the foundation for evaluating consortia. And they suggest that we must focus on quality collaboration and communication, performance and infrastructure quality, data quality, scientific productivity, impact on member organization, and impact on the community. Since then, the CDC, the NIH have adopted this evaluation areas as the primary thing that one needs to focus on when looking on evaluating consortia research, whether it be for cancers or other non-communicable diseases. Eventually, we hope that through evaluation and real-time feedback to projects, pilots, cores, collaborators, and the public, we can improve or enrich the knowledge of both patients, providers, and researchers, increase awareness, change attitudes, practice, and behavior. So moving from not just the bedside, but we're moving to the community, we're moving to the laboratory. So we're looking to make changes across a continuum of where work happens when it comes on to ameliorating the risk factors related to prostate cancer. Doing this work also allows for collaboration opportunities. There is a feedback loop where whatever we identify as an evaluation team goes to the administrative core, which is something that is quite unique to iCCaRE, and therefore that evaluation data is supposed to be fed back into projects, cores, pilots, services, collaborators, and even into the public. We try to pull all of this together to demonstrate how well we are doing through various approaches. One of the approach, of course, is a social network analysis, which shows how we are interconnected. And this afternoon, for the first time, I'm going to share with you a little bit of data from our social network analysis that, I've been particularly interested in to see how iCCaRE is doing in terms of collaborating both within the consortium and outside of the consortium. So for focus this afternoon, we're going to just look at one of those domains. We're going to pay attention to the extent of collaboration and quality communication. And there are 3 different subscales within this evaluation criteria. We look on collaboration across institutions, we look on communication quality, and then we look at the decision-making processes. This includes things like transparency, inclusivity, and timeliness of decision, and just people feeling like they belong to a group or belong to the consortium, as opposed to just being invited for their opinions and then at other times, disconnected from the research. The methods that we use to analyze or to evaluate this subscale include surveys, member feedback surveys, and a few data audits from reports that are done by the research team. The frequency includes quarterly administration of some surveys and then biannual circulation of some surveys. So let's dive right into it. So when we look at who participated in our general evaluation survey, which is the primary source of the data for this presentation, we see that project coordinators or project managers represented 25% of the population here, and our sample size for this round of data is 47. We see where this is followed by our PIs and MPIs, so 21.3% there of the sample is made up of MPIs and PIs. So by and large, the people who are on the ground running the projects, coordinating the projects, and the investigators make up a large portion of this sample size. In terms of their tenure in the consortium, we have the majority of people being in the consortium for more than 2 years, just around 50%. So when looked at it all together, people being between 1 to 2 years, we're looking at about 83% of folks saying that they've been in the consortium for more than a year. So the first subscale we want to focus on is collaboration. And I was particularly intrigued and excited by what I saw, and I hope this will demonstrate to you some level of excitement as well, or generate some level of excitement when you see what's going on in iCCaRE. So let's look at inter-consortium collaboration. When we think about inter-consortium collaboration, we think about the number of requests made by project services and cores within iCCaRE to the core and services area of iCCaRE. So here we see that there were 31 requests over the period of 1 year. And so we see that the majority of the requests came from the partnership engagement services. So they made 10 requests. And then FP1, Full Project 1, made 6 requests. And then there were some other requests, and we identified those requests as coming from a 5K that is geared at prostate cancer, Ironman, the 3 pilot projects in Africa, and from CAPTC. And those made up the majority of the requests that was made to services and cores. In terms of the services and cores that received the requests, let's take a look at that. The media core received the majority. 6 of the requests that were made came to the media core and were responded to by the media core. Then DAMAS, the data management and analytics services, provide requests to 4 projects or pilots that sought their services. Similarly, the partnership engagement services provided 4 response, as well as the evaluation core providing 4 response. So there you can see some kind of inter-consortium collaboration where there is a working together of the projects, pilots, cores, and services to build or to feed on each other. So the work that is being done is not being done in a silo, but rather it is being done across the consortium in terms of shared governance, shared resources, and shared skill set and capacity. So let's take a look at this network analysis. And I'm going to probably live here for a little bit so that we can understand what is going on. I selected 15 publications from iCCaRE that was perhaps published between 2025 and 2026. And these 15 publications are publications that are indexed in PubMed. And if anyone is interested in finding out which 15 I use, of course, iCCaRE has produced more than 15 publications. But I've used these 15 that were indexed in PubMed because of their just availability and being able to look at these publications in depth. What we did with these 15 publications was to conduct a network analysis based on the affiliation information for the authors that were on this publication. Immediately at the top of the screen to the right side, you can see that the network profile suggests that there are 40 distinct parent institutions or organizations represented. So 15 publications, but 40 institutions or organizations involved in producing the work that went into these publications. At the top of the screen, you will see what we refer to as nodes. These are the circles, and the nodes represent US-based institutions. And the larger the size of the node, so the bigger that circle is the more often people in that organization appear on the publication. So more people on the publication from those institutions, the bigger the circle is going to be. But clearly you can see that also the color of the US-based organization are diverse, meaning that it include academic institutions in the green, it include health system or cancer centers in the pink, it include community-based organizations in the yellow, it also include you know, private sector that is there. And one of the interesting thing that we can see as we move across to the lower side of the network analysis is we begin to see a little bit more diversity. We begin to see private sector in the form of pharmaceutical industry. We begin to see nonprofits. And notice all those greens that you see at the bottom of the screen. These are nonprofits that are involved in the work. We also see other countries. So if you notice there, the UK is involved, Canada is involved. But then take a look at the outer layers of these circles. The outer layers of these circles are colored as either blue or they're colored as red. If they're blue, it means that the countries we're looking at are high income countries such as the United States, Canada, and UK. And then the red represents more lower middle income countries. And while Nigeria is the country that is majority represented here, we know that the work is taking place in other African nations, and they are perhaps just not represented in these 15 publications. The other thing we want to look at is the thickness of the line. The thickness of the line that moves from one node to the next looks on the number of selected publication in which two institutions co-occur. So notice the lines that are moving between, for example, the Mayo Clinic and CAPTC. Notice at the center of all of this is iCCaRE. And so the thickness of the line moving between, for example, iCCaRE and the University of Oklahoma Health Sciences, between iCCaRE and Georgia College and State University, between iCCaRE and Mayo, between iCCaRE and CAPTC. These represents that there are multiple times where these two institutions or these institutions are working together. Hence, the collaboration is not a one-off collaboration, but the collaboration is consistent and it is a collaboration that is growing. Again, this is very early work, preliminary work, and once we get around to putting together all the publications to look on even wider or larger network analysis, you'll begin to see even greater number of collaborations, thicker lines moving between institutions. One of the things we want to showcase here is also not just healthcare systems that are private, but healthcare systems that are public. So for example, the Meade County Health Department is represented to the upper left of this screen, as you can see. So all in all, significant collaboration, both inter-consortium collaboration and collaboration outside of the consortium globally is happening in a significant way for iCCaRE. We're going to move to our next subscale, which is communication quality, to see how the members of the consortium perceive communication quality within the consortium. So notice now this is process evaluation. We're not necessarily looking at outcome of terms of external communication. We're looking at internal communication because we want to better the machinery or the mechanism of iCCaRE. Here you can see that individuals responded to this activity, asking how informed the respondents feel about key activities that are taking place within iCCaRE. And by and large, you can see that with the exception of consortium projects, more than 80% of persons who responded to this say that they are as informed as they need to be. If we zoom in a little on the activities of consortium project, we see that greater than 2/3 of individuals say that they're as informed as they need to be, with just about 14% saying that they're not as informed as they would like to be. And we'll address this when we get to the takeaways of this presentation. Again, how members stay informed. So in this particular question, multiple responses were allowed, and we asked people to just kind of indicate how do you normally stay informed. By and large, you can see that email is the primary way people say that they stay informed, but project meetings, core meetings, and monthly webinars like the one you're on now is a way that people identify that they stay informed. Importantly, I want you to pay attention not just to the bars about how people stay informed, but the multiplicity of bars that you see on your screen. Interestingly, there are several different platforms, and one of the things that is emerging from this work is how we can better utilize the multiple platforms that we have, sorry, in terms of our information need. And you're going to see why I'm emphasizing why we perhaps need to uh, capitalize on the number of platforms that we have. When we ask individuals about potential barriers to communication, they indicated that there was information overload. This is the major barrier. People are saying that we have too many emails. And I can understand why people would think that. But again, the preferred method of communication is email, right? And then we see the second thing that is coming up or emerging as a barrier to communication is the overall size complexity of the iCCaRE consortium effort. I was very intrigued by these two responses of information overload and overall size and complexity of the iCCaRE consortium effort. Of course, being a person who is not deeply entrenched in prostate cancer science at the bench level, I too sometimes find the complexity of the projects to be interesting, but not necessarily a barrier. So I wanted to find out who was saying what. And so we did an analysis that looked on a cross tabulation between your project role, so your role in the project, as well as your barrier that you identified for communication. Because MPIs, PIs, project coordinators, and managers make up the larger part of the sample size, we looked primarily at what they were saying. So for PIs and MPIs, with a N equal 9, a sample size of 9, we found that the majority of them were saying that the overall size and complexity of the iCCaRE consortium effort is what was the barrier for them. And so just about a third of them said information overload. So the NPIs are perhaps okay with the emails, but you can see that the complexity of some of the projects present a challenge for them. When we look at the project coordinators and managers of projects and cores and services, the reverse was true. The majority of them were saying that information overload was their primary barrier, meaning that it was too many emails. The other group that showed up in the analysis that I did not put on the screen today is our early career investigators. And they primarily said that they did not know who to communicate with. The majority of them were indicating that that was their barrier, knowing who to communicate with. And we'll address that in the takeaways a little later on. When we look on the website, 45% rated that the website was somewhat easy or very difficult to navigate. So that's a growth opportunity for us there. But by and large, you see that 43% of individuals said that it was very easy to navigate the website. And something that I'm still trying to figure out, and perhaps we'll dig a little deeper into this, is those who say that they can't evaluate. This may represent people who have not been on the website or people who don't use the website for locating information about iCCaRE because they get it from other sources. In terms of searching the website for content and informing members about iCCaRE activities, so this is, advertising. Again, we find that 1 in 3 members find the website somewhat effective or ineffective or very ineffective for providing information on iCCaRE. So another opportunity here for growth in terms of making the website an actual tool that can service providing information and keeping individuals both within the consortium and outside of the consortium informed about the consortium activities. And then we move to our final subscale. This is the subscale on the decision-making process. And again, this is again the perception of members within the consortium and what they think. And again, exciting results that I want to share with you. So when we think about perceived change compared to a year ago, so this is primarily for those who have been in the consortium for more than a year, we see that by and large, the majority of individuals say that the consortium, in terms of assisting with administrative issues, has gotten better. New proposal development, it has gotten better. Data coordination has gotten better. Dealing with publication issues has gotten better. Overall leadership has gotten better. Promoting communication across sites, that has gotten better. And so all of the domains within or improvement subscale for decision making, we are finding out that people are saying that this has gotten better. There are a few spots for growth. As you can see, dealing with publication issues comes out to be something that might take some fine tuning. And so I know that we are working on that. And so it is going to be interesting to see what the second administration of this biannual survey finds when we look at how people say we are doing once we get to 2027 compared to what has happened in 2026. When we think about team functioning and how it is rated, individuals rate team functioning as positive. So there's a positive functioning of the team. So you see that agree and strongly agree ranges from 86.4% to absolutely 100% in some cases here, where team members feels that the meetings, people are given equal opportunity to contribute. There is no conflict or disagreement that cannot be resolved effectively. And for growth, we are seeing that productivity in meetings, there could be some improvement there. And we're going to talk about that some more in the takeaways as well. We also want to look on guidelines for authorship processes. So we ask individuals to rate accessibility and clarity and collaboration as it relates to authorship guidelines. And again, we can see that agree plus strongly agree accounts for 72.7% to 86.4% of responses across guideline measures. So whether we're looking on authorship guidelines, accessibility of information, or whether we're looking on manuscript development done in a collaborative manner, people are saying that they agree that this process is clear and this process is a positive one and a positive experience. And these are the kind of things we want to see in any collaboration. So for any consortium to be successful, these internal processes need to be working well in order for us to see positive outcome leading to significant impact in reducing the prostate cancer disparities, or as we've said, preventing prostate cancer altogether. We also looked at fostering cooperation and creating opportunities for input. Of course, as you know, iCCaRE has within it what we call early career investigators, as well as we have community principal investigators, something again that is very strong in iCCaRE. And therefore, if you have individuals who are at their early stage of their career or individuals who are from the community, there needs to be cooperation and opportunities for them to give input. So let's see what they said. Altogether, consortium members said that there is positive, or what we refer to as very effective, cooperation and opportunities for input. So most people are saying that yes, we feel like we belong, we feel like our voice or talent or skill set matters, and it is making a difference in the lab we are based, in the project or core or services or pilot that we are engaged. People are saying that they feel like they are being cooperated with and they are being given a chance to make input. Our final bit of results that we're going to look on this afternoon is research collaboration opportunities. Again, this is a research consortium, right? And therefore, research opportunity is at the forefront of what we do. We do not want to do research in the way that it was being done in the 1700s by Edward Jenner. Just between him, his dairy maids, and his little boy or the housemaid in a small group in his office somewhere or in his home. We want to be doing research much like the over 3,000 scientists that came together to work on the Human Genome Mapping Project. And therefore, we want to make sure that research collaboration opportunities is at the forefront. So what did the data say? The data suggested that almost 90% of the respondents agreed or strongly agreed that iCCaRE has generated discussion of new grant and manuscript collaboration opportunities in the past year, so much so that it has resulted in multiple grant applications being made and multiple successful grant applications being awarded. But again, the purpose of this presentation is not to showcase those grants and those manuscripts. It is to talk about the internal processes that has led to these significant outcomes that we're seeing in iCCaRE. And so altogether, the engine, the machinery within iCCaRE is working well. And as for any machine, there is some opportunity for fine tuning to make sure that we are burning fuel smoothly and that we are progressing to ameliorating risk factors and challenges related to prostate cancer screening, prostate cancer prevention, prostate cancer management, and prostate cancer treatment. So what are our key takeaways from today? In terms of collaboration, consortium collaboration between projects, services, and cores exists. We've seen that. They are collaborating. We are collaborating. However, there is a need for consistent use of the core services intake form to document collaboration. We feel that there are more collaboration that is taking place than our data is revealing because some of the forms or mechanism that we have put in place to document the collaboration is currently not being maximized. So we are encouraging smoothness in terms of collaboration when these forms are utilized. There's evidence of strong publication collaboration with consistent and equitable involvement of sectors and even countries, early career investigators, departments of public health, private sector. And so there's strong evidence of collaboration. There's also opportunity to document and evaluate community involvement. This is something we have not been focused on, but this is an area that we can grow into to making sure that we document in the network analysis the magnitude of community involvement and documenting the way they have been involved in the projects. In terms of communication, multiple communication channels and platform exist within the consortium. As you can see from what I demonstrated earlier, there's over 15 different channels that we are using to communicate. However, email burden was identified as a barrier to communication, primarily for those in the trenches working to coordinate and manage projects. And so there is a need for approaches to streamline information sharing across the different communication channel that could alleviate the information overload. So what we're going to work to do is to streamline different communication channel for different individuals that may not necessarily be accessing the information at the point at which it is most convenient for them. And we do have the tools. It's a matter of mapping the tools onto the audience, the stakeholder or interest holder group that it is most relevant to. A final takeaway as it relates to decision making, the consortium members perceive improvement in shared governance and transparency within the consortium. And this signifies that the consortium is healthy, growing, and will only get stronger. When people feel a part of something, feel like they belong, then ultimately we are going to grow, we're going to go places, and we are going to be successful. There's our growth opportunities for sharing guidance for authorship and communication channels. So this is something that we are going to be working on, the sharing of the new guidance that has come out for authorship and the publication committee has been working significantly on trying to improve that process, and we're hoping to see that reflected in the next iteration of this survey. The other thing that we think is a growth opportunity is action items list for meetings. And this, we believe, may further contribute to the already productive meetings that are taking place within iCCaRE. And so one of the things that we gleaned coming out of the survey is that folks are saying if they had an action list to keep them focused on what they need to do in between meetings so that they have them met by the next meeting, that would be useful. We do have the tools to provide such action lists, and this is something that is a growth opportunity that I look forward to see how well that has worked. So all in all, the consortium process evaluation suggests strong areas where we are growing well and improving, and also some opportunities for even further growth and improvement. Thank you very much for your time. And if there are questions, I'd be more than happy to take those questions. If folks want to write those questions in the chat, or if want to put those in the comments, please feel free to do so. If you also want a list of the publications that went into the network analysis for our publication, showing how tremendously well iCCaRE is performing as it relates to collaboration internationally, I'll be more than happy to provide a transcript of that those publications as well.
All right. Thank you so much, Dr. Francis, for that very thorough presentation about the iCCaRE Consortium, what we're doing very well, and also those areas for improvement as a global consortium. Like Dr. Francis said, if there's any questions, comments, please feel free to drop them in the chat. We do have a few minutes with Dr. Francis. All right, so I'm just reading the chat. I do see some comments. We have that network analysis that you showed, great visualization of the horizontal collaboration among the institutions in iCCaRE.
Yeah, and I could talk a little bit more about the network analysis. It's something that we are wanting to do on a greater level. This one is primarily from publication. So this is secondary data that we are collecting and using for the network analysis. But ideally, what we would want to be doing is collecting real-time data, primary data from those individuals who are working in different groupings to identify what are the nodes and to look at the interconnectedness between nodes for more than just publications. Because of course, publications is the end result of what we do, but we do many more things together. We do presentations together, we do workshops together. If you think about it, we do lots of trainings together, we teach together, we're in the lab together, we're making discovery together. So publication is perhaps the smallest piece. It's the iceberg that is above the surface of the water, the tip of the iceberg in terms of collaboration. So if we were to drill down and look at the base of that iceberg, I guarantee you would see in this network analysis an even greater level of collaboration and interconnectedness globally for iCCaRE.
Right, I completely agree. Let's see. Any other questions or comments for Dr. Francis while we have him? All right. If there aren't any questions, wait, give me one moment. But we did have a question drop in the chat. I'm going to put it on the screen. So Dr. Kanenjing, he thanks you for this great presentation. In terms of communication, did you break down the results by tenure of respondents, such as early career versus established researchers? Was there any difference?
Yeah, so we did look at some crosstabs, and I didn't present all of that data, and I primarily didn't present all of that data because we'd have to cautiously interpret the data because it is going to be more preliminary because of our sample size, and that's one of the limitations I should have mentioned in my presentation, that a sample size of 47 really doesn't help us in terms of crosstabs and looking on the subsections or different groupings. It does well for overall picture, but if we begin to look on breaking out the different groups, because of how small those cells are going to be, it won't give us very much meaningful direction. But clearly, the early career investigators, as something I mentioned, one of their challenges in communication is knowing who to communicate with. And the groups that were making up the larger portion of the sample was our MPIs and PIs being N equal 9, and our project managers, coordinators, N equal 12. So really and truly what we are pushing for is, if you are on this platform this afternoon watching this presentation, get in touch with Jada, get in touch with Jeffrey, find out how you can give your feedback on how the processes of the consortium is working by filling in our general evaluation survey. Everybody is welcome to fill it in, as long as you are a user or a producer of information that is being delivered by iCCaRE. So short response to your question, Dr. Keninjin, is that some of these crosstabs that we would want to do to look on what is happening in different categories would not meet conventional level of or assumption when we do cross tabulations because of small sample size. But we did see something there for early career investigators with their communication issue being who to communicate with. We did see that our project coordinators, their main barrier to communication is information overload regarding email. And we did see from some of the MPIs, PIs, that their concern is the complexity of some of the projects. And so perhaps what we ought to be focusing on is how well we can explain, or opportunities to explain, what we do in our different projects to our partners who are working on other projects. So, for example, FP1 might spend some time explaining to FP4 what FP1 does. I know a lot of us are excited about what is happening with Vera, and we know a lot about Vera, but some of the other projects perhaps are less understood by the consortium at large.
Thank you, Dr. Francis. All right. Do we have any other questions for Dr. Francis? Please feel free again to drop them in the chat. Make sure I didn't miss. All right. If we don't have questions currently for Dr. Francis, or if you would like to reach out to him directly with those questions, he does have, again, his contact information on the screen, including his email and his LinkedIn. So we don't have any other questions. Give me one moment. So we don't have any other questions or comments for Dr. Francis. Dr. Francis, we would just want to send, on behalf of the iCCaRE Coordination Center, a huge thank you for your presentation. I thoroughly enjoyed it. And we look forward to having you or anyone who represents the Evaluation Corps do another webinar in the future. We also just want to thank the Evaluation Corps for everything that you do for the consortium, because with you guys, that's how we, of course, know how to improve, know what's doing well, etc. So with that being said, we hope everyone who's joined today has a very great Friday and weekend, and we will see you again soon next month. Actually, next month, reminder, is Prostate Cancer Awareness Month, so stay tuned for some special webinars for the month of September.
Wonderful. Thank you so much, Jada, for having me. And just want to, again, shout out to the team. Thank you for your hard work. We have 4 more domains in the evaluation work that we do. So we can at least present 4 more times if you want us to present. So please feel free to ask us if you want us to jump on the webinar. Our team would be more than happy to continue our presentation series.
We sure will. Thank you. All right, everyone. See you same time next month.